People take for granted the mobility of their limbs until one day they realize something is off or needs correction, so they go to a doctor for help. Oftentimes, doctors don't spend adequate time explaining to their patients complications that can result from surgery. Carissa's story is no different. However, we should take to heart what she has to say.
In my sophomore year of high school, doctors had decided to give me knee surgery because I had been born with my patella 50% off from being straight, so my knee was crooked. It was my decision whether or not to get the surgery, and I was a basketball star at the time. I started freshman year on the JV and freshman team, and I had played basketball for 10 years before that. So they told me if I got the surgery, it would make my life easier, I'd recover better, and everything would be fine.
Did you think about any future complications from receiving the surgery?
So I decided to get the surgery, not thinking about if anything could go wrong, because doctors don't tell you all of the things that can go wrong. They just slide by that part. So I got the knee surgery.
The day of the surgery, what was it like? How did you feel?
It was the last day of school. I went into the hospital. They wheeled me in. I sat down, got the anesthesia. I woke up about 5.5 hours later after surgery. And I wasn't really awake, actually. Coming out of anesthesia, my heart slowed too much to the point where I almost died. So I was able to hear the chaos that was happening around me with my mom crying and people screaming, but wasn't really lucid.
I can almost imagine the scene in the hospital room. Frantic doctors and nurses scrambling, trying everything they knew to do to bring Carissa back. Her mom in the corner, crying and crying, just waiting. But would her daughter pull through?
Finally, after they got my heartbeat back up to normal, I woke up. I went to leave the hospital. They kicked me out of there because they did not want me staying overnight. So I went home. I have a blood condition where my blood doesn't clot. They knew this going into surgery. So they said everything would be fine with this. Also during surgery I got a nerve block, which prevented any pain from happening for at least a good 2 days. Then after it would wear off. And that was on top of the Percocet and Vicodin I had to take every 2 hours. I had to set my alarm. So I wasn't really lucid for the first week or two.
Anyone would feel like they're living in a fog between what is seen and what actually is after receiving high dosages of medication on an hourly basis.
I was supposed to take my first step in 6 weeks, if that. That was the longest time. Because of the nerve block, it actually deteriorated my muscles in my thigh, so I was not able to walk. I lost about 3 to 4 inches in my thigh. It was 3 to 4 inches smaller than my left thigh. So I wasn't able to walk. I was on crutches for about 3.5 months. In physical therapy 3 times a week. The entire summer I spent in the living room on the couch bed, not able to move. So finally school started again. When school started, I actually was able to take my first step, which was, it wasn't a step, it was more like a hop. Then after that, I slowly weaned my way off of crutches. I was able to walk again. By the time I was fully technically recovered, it probably was about 4.5 months after the surgery. After surgery, things also didn't go as planned. The muscles in my leg deteriorated so much that I couldn't ever have a normal muscle strength there. Couldn't lift up my own leg for a long time. Still, it's hard to do now. And my knee gives out more. And because there's no muscle there, and because the nerve block also deteriorated the muscle, I also lost all my nerves on the right side of my right leg, because the nerve block sometimes has that effect, but they don't want to advertise that. And to this day, I still can't walk normal or do normal functions that most people can.
Every day, Carissa struggles with aches and pains, along with the thought of a lost opportunity to have played for UConn on scholarship.
I never got to play basketball again, which was sad because I was heading onto the UConn track. Hopefully I was going to play basketball there on a scholarship, but that never happened. And it was one of those decisions that I regret to this day, and I don't have many regrets, just learning experiences. But if I could go back in time, this would definitely be the one thing that I would take back, because my life would be 10 times different than it is now.
Thinking back on her surgery, Carissa feels as if it was something she regrets. However, what would have happened if she had never gotten the surgery? Would she even be able to play basketball today? No one even knows. They say hindsight is 20/20, but it's hard to see what is ahead when you live in the present.